StoryCare is a very simple process for engaging teams with rapid cycle improvements. And it's using the power of story as a tool for simulation. So for teams to be able to see new possibilities and to try new behaviors. It's that simple. There's lots of stuff that people are doing out there. There are a lot of consultants working in healthcare. You can hire a consultant to come in and tell you what to do. So you can get a prescription. Yep, your people all ought to do this. And so you'll go into some of those settings where you'll say, "Hello, Mrs. Jones, how are you?" And they'll have a script of what they're saying, and all of us as patients go, "Knock it off. Be a real person." Okay. So you have some of that. There are companies who believe rounding is the way to go. So we need to teach our leaders how to be good rounders and engage, and we think that's just part of the process. And then you've got the training companies. You got people out there doing training, and some of them do very good jobs. Our partner, Healthcare Team Training, who is actually our distribution channel and our partner helping us develop the product, they're experts in a thing called Team Steps. And Team Steps stands for Team Strategies to Enhance Performance and Patient Safety. It was developed by the Department of Defense. It was taking the lessons of the cockpit in the airline industry, why planes crash, and trying to transfer those lessons into healthcare. And they found two reasons primarily why planes crash: poor teamwork and poor communication. So they used Team Steps, which they took the lessons of healthcare about teamwork and communication, and they've brought those into places like the operating room. If people aren't communicating well, and something's going wrong, and things go wrong in operating rooms. We just wrote a story yesterday. This is great. I wrote a story yesterday, and the story was all about, at the conclusion of a surgery, they have to do a count of all the sponges and all the other instruments to be sure they haven't left one in the patient. Now, the standard operating procedure is that they're not supposed to close the patient until someone says, "Yep, we got everything. We got the count. They're not in the patient." But what happens is surgeons are, they're ready to move on to the next thing. They're closing the patient up. And someone is over there feverishly trying to collect all the sponges and make sure they got the right number. And what happens sometimes, they go, "We're missing a sponge." So they say to the surgeon, "We're missing a sponge." And of course the surgeon says, "Well, count again. It must be here." Okay. And then they count again. "I'm sorry, doctor, but we're missing a sponge." And now the doctor is really exasperated. And so what they end up having to do is come in and x-ray the patient while they're there in the operating room. And sure enough, there's the sponge. They got to reopen the patient, remove the sponge. Now, often that's not a terrible thing. I mean, the patients may not even know that this was done to them, but it could impact safety. Okay. So the big deal is having a nurse empowered enough to speak up and to challenge the doctor. Okay, there's a couple different things that come out of Team Steps for that. So this story that we just wrote reinforces some of the Team Steps lessons. So you could train people in those concepts. You should speak up every time there's a problem in the emergency room. But if we're not talking about it every day, and we're not supporting you as a nurse or as a technician to challenge a doctor, and it gets even more complicated in military hospitals. So here I am, an ensign, and I've got a captain who's the surgeon, and I got to say, "Captain, I think you screwed up. You left a sponge in." Well, if I'm an ensign, I may be a little reticent to say something to the captain, because I'm not supposed to be challenging my superiors. So you have these issues of culture, and so where our product really comes in is that, yeah, we could train people on that, but how do we sustain it? And so every month there will be a story that's focused on these kinds of issues, and so we think that there's an important place for the product. We think that we actually, if we're right, we think it's going to become the leading product around change in healthcare in the coming years. Sure, there are other companies will try to mimic it and copy it, but we're the first people who've gone out with a story-based product to change healthcare or change behavior, and it has, I think, broad applications beyond healthcare. You could go into hospitality, you could go into other industries and do the same thing.